Hi, I'm Laval Jensen, Executive Director and CEO of Bear Lake Community Health Centers. We have 4 locations, one in Hyrum, Garden City, Evanston, and Cache Valley Community Health Center in North Logan. We offer an integrated approach to primary medical care, which means that you can receive all of your basic healthcare needs in one location. These services include family practice, OB, preventative and urgent care services, dental, behavioral health, and pharmacy. We serve all patients, those who are insured, uninsured, underinsured, and we offer financial assistance programs for those in need. We have providers who are fluent in Spanish and offer other interpretive services.
So a patient-centered medical home is really this idea of the primary care clinic being the home for all of the patient's medical information, medical care, prescriptions, just providing that full round of health care. We offer a number of services to our patients at the clinic, that includes medical services where we have 3 providers, and that includes physicians, physician assistants, and also nurse practitioners. We have a dental clinic where we have 2 full-time dentists and several dental hygienists. We also have a behavioral health service with an in-house psychologist. We have a pharmacy, and we have several PharmDs who are working with us very closely on patient medication management. And then finally we have some imaging services that we can offer with some x-rays for patients. So with patient-centered medical home, we really are focusing on getting patients in to see the same provider from visit to visit so that they know the most about that patient. We have gone through a process here at the clinic called empanelment, where we have looked at all of our patients and really tried to assign, with their help, assign them to one primary care provider who is responsible for their medical care, responsible for knowing what they need, and also responsible for all that preventive stuff that may not be discussed in the office, but when they leave, we will call them and get them in for mammograms and their preventive care services.
Some of the tools that we use to kind of help keep track of some of these ongoing needs of different individuals, really our electronic medical record has been invaluable in helping us to do that. You know, we use a specific CompuGroup medical electronic medical record, and it does provide kind of a tracking system for each of the patients, and whether or not they've had specific labs drawn that would be recommended, whether or not vaccines have been given or not is also available in that electronic medical record. We do use some of the state-wise databases as well, specifically for our children, our youth patients, including the USIS program that tracks all of the different vaccines for our individual patients. And in those morning huddles that we do as a team when looking at our schedule for the day, we review those lists as well, not only from our EHR, but also how well it matches up with those other databases that are available to use.
So before the medical home transformation, a lot of time was being taken by the providers for paperwork, being pulled in a lot of different directions. Oftentimes the medical assistants may not know as much about the patients before the medical home because they weren't assigned to any particular patients. And so now that we have the medical home in place, every morning we do what's called a team huddle. We all meet, we look at all of the charts of the patients that are coming in that day. We know before they ever walk in what vaccines they need, if they need a mammogram, and we have that paperwork and those orders ready to go when they come in. So less time is spent on doing paperwork and trying to figure out what is needed for preventive care, and more time is spent focusing on the patient in the actual exam room.
I believe as a dentist that you know, I focus on the head and neck area. That's my area of specialty, and yet that is really just part of the whole body, and being able to coordinate that in-house with our medical providers and having a pharmacist who helps us when medications are needed. I can't think of a bigger positive for a patient to be able to come to one place and to have that input and to have that coordinated effort towards their goal of overall health. One of the great things with having an in-house pharmacy is many of the patients we see have a need for pharmaceutical care and prescriptions. Having access to a pharmacist on site that we can consult with for patients that have multiple, that are on multiple medications, that we need to be very specific about which medications are safe for them to take or assume, is an enormous benefit to have that in-house. It's great to be able to escort a patient to the front desk on their way to check out, and while that process is being done, if they're in need of a prescription, that's being filled at the same exact time. And so when they leave our facility, they leave with not only what we did back here in the dental clinic, but they leave with their prescription. They don't have to go somewhere else.
I guess one of the things that I enjoy most about being a provider in a community health center, and that I've been able to perhaps uniquely experience at this community health center, has been the opportunity to visit with individuals with or without insurance and have both of them, both of those patient populations tell me that we continue to come to this location because of the excellent care that we receive. Not only because of the different programs, discounts, or benefits that are available, but because of the excellent care, the excellent providers, and the positive team atmosphere that exists here.
We love what we do and recognize the opportunity and understand the responsibility in providing excellent medical health care.